Respiratory care program is obviously a hospital-based profession. We work a lot with COPD patients, smokers, emphysema.
You work with people who have difficulty breathing. They have some lung disorders or issues, or people who have been in traumatic accidents and they can't breathe.
There's kids with certain diseases that we work with, such as cystic fibrosis.
Whether it's babies, like newborns, all the way up to your elderly people, 80s, 90s. So it's a pretty wide spectrum of respiratory assessment and treatment.
And we work with putting people on mechanical ventilation or life support and different sleeping disorders we can touch on too.
It runs over 18 months, and when you come out of this program, you'll have an associate degree in respiratory care, and you will be able to sit for the national exams for certification and then for registry.
They can go to any facility after they take their boards. They have to take their CRT boards and then their RRT boards, and then pretty much they can apply to any healthcare system that has respiratory therapists in it, which all do in the country, so they can move wherever they would like.
Also, with less and less physicians, they're using more respiratory therapists as physician extenders, so that they'll have a lot more responsibility in the ICU and at the bedside for the actual care of the patient.
If somebody is not apt to working in the hospital clinic setting, there are different smaller things that we can do.
This program offers a lot of job opportunities after you get out because it's so broad with what you can do.
You can work in hospitals, nursing homes, sleep labs. You can work in any setting, honestly.
ICUs even. There's a home care. I mean, there's a really wide variety of areas you can work in healthcare.
Respiratory care is really a growing field with the aging population. It really is a growing field because a lot of the people, as they grow older, have more and more lung disease. So they are expecting the baby boomers to really saturate the market with patients with respiratory illnesses.
With the baby boomers getting a little bit older, a lot of them smoked at a young age. And so this program right now is booming as far as finding jobs.
Respiratory therapists are going to be more and more in demand as the population ages. They're expecting it to grow like almost double.
There are a lot of different labs that we do. We have a lot of fun in lab. We hook each other up on different masks. We play with these different mannequins in here. And we learn how to intubate people.
We do CPAP and BiPAP, and there's masks and other variations of that, and they apply pressure to your airway to help it stay open so you can breathe easier, like for people who are in respiratory distress.
We do a lot of stuff in the lab. It is very hands-on. We have all these mannequins. We have the exact same machines they use in the hospital, and we put them on ourselves. We treat these mannequins as if they are a patient.
Or we can do blood gases where we're poking somebody's artery, and that's pretty cool.
Right now, these students are in their basic rotations, so they will go into the hospital and work with patients with lung diseases, cystic fibrosis, asthma, COPD, pneumonia are the big ones. And they'll give them breathing treatments and administer medications to the airways.
They go to all different hospitals, all different sizes. They go to small hospitals to large hospitals, and they work directly with respiratory therapists, doing patient care on real patients in the hospital, so maintaining the ventilators, doing the breathing treatments, the stuff they've practiced in the lab, and they homed in and then skilled on those facilities, and they take them to the hospital and do them on real patients that need help, and that's how they learn to master their skills.
And in the summertime, they will be going into the ICU and dealing with patients on ventilators, which are basic life support, and machines that actually breathe for the patient.
But you do hands-on training. That's the best way to learn. I'd rather be in the hospital than sit in a classroom taking tests. So.
I want to deal with one area of the patient, not the patient as a whole. So if you'd like to be a little more focused like me, respiratory is your area.
You should do it if you're really into people and helping people. I would recommend this one over anything.
You need to breathe. If you can't breathe, you're gonna die or you're gonna have a horrible time. So who doesn't want to help with that? And honestly, I think it's cool.